Hi, I'm Dr. Rajeswaran, consultant endocrinologist and bariatric physician. I see a lot of people on GLP-1 analogs, that's Wegovy, ozempic, Mounjaro, or Zepbound. And they come and ask me, what's the reason for abdominal pain? There's several reasons for abdominal pain. I'm going to talk to you about the 5 most important reasons for abdominal pain in people having Wegovy or Mounjaro. Okay, before I go on to the actual reasons, I need to mention this, that people with obesity are more prone for abdominal pain. The prevalence of gallstones, pancreatitis, any form of inflammation is higher in people who are overweight or obese. There are several reasons for gastrointestinal side effects because the way it works, the way these medications work, is they stimulate the pancreas to produce insulin, and they also block a hormone called glucagon. They slow down the peristaltic movement, so you start to feel full. And they also suppress the appetite by affecting this appetite center in the hypothalamus. So that's how it works. Now, why would someone on Wegovy or Mounjaro have abdominal pain? So as I said, the common side effect is nausea, vomiting, constipation, diarrhea. But sometimes nausea can get really bad and people can be vomiting, and there can be a reflux. It's called upper gastrointestinal reflux disorder, GORD. And when this happens, there's a spasm to the esophagus, and that causes severe pain. So excessive vomiting, heartburn can cause pain. So that's the first reason, and which is the most commonest reason. The second reason is diarrhea and constipation. So what I've seen in my practice is people complain of both diarrhea and constipation. Some have severe constipation and some have diarrhea. So both of these conditions can cause mild inflammation of the gut, and that can lead to abdominal pain. But sometimes constipation can be really bad, and that can also cause abdominal pain. So that's the second reason. The third reason is when there's increased slowing of the gut movement, that's the action of these group of drugs. It can cause a very serious side effect called gastroparesis. I'm going to put the link below, and there's a separate video just on gastroparesis because the serious side effect is very important for you to understand what the symptoms are and seek immediate help if you think you've got gastroparesis. Gastroparesis is paralysis of the gastric movement. So you have bloated sensation, you don't pass, you open your bowels for several days, and you have lost your appetite completely. So in that situation, it's very, very important to seek urgent medical help. So I've spoken to you about 3 reasons for abdominal pain. The fourth reason, and one of the common, not so common, but I see it quite common. The reason I see it's quite common is I see people who are not on GLP-1s, who are not on Wegovy or Mounjaro. So they come to me post a bariatric surgery, and they come in with abdominal pain, and then we investigate and find out they have developed gallstones. So wherever there's a rapid weight loss, that can cause gallstones. So people who experience rapid weight loss are more likely to have more gastrointestinal side effects. And gallstones is one of them, though not very common. So there's not only gallstones, but there can be inflammation of the gallbladder. So that is called cholecystitis. Cystitis is inflammation. Tis is inflammation. So there's also gallstone formation, which is cholelithiasis. So lithiasis is stones. So gallstones or cholelithiasis and cholecystitis or inflammation of the gallbladder can be seen often in people who are on Wegovy or Mounjaro. So if you experience severe abdominal pain, in some people they can even have fever, altered bowels, please seek immediate help from your doctor or go to the nearest accident and emergency department. So that's the 4th reason for abdominal pain. The final one which I know of and which is quite rare is pancreatitis. People who have gallstones can also develop pancreatitis. Pancreatitis, as I said, tis is inflammation, which is inflammation of the pancreas, and that is seen again. I've seen this in people who've been on very restrictive diets, they can develop pancreatitis. So anybody who has a rapid weight loss can develop any of these symptoms which I've mentioned. So pancreatitis is a rare side effect, a rare gastrointestinal side effect, and if you have central abdominal pain and which is unrelenting and it's going on and you're having nausea, vomiting, seek immediate help. You'll be investigated, you'll have some blood tests, a scan of your abdomen, and if there's inflammation of the pancreas, an appropriate action would be taken. So if you have any of these symptoms, it's important to stop this medication as we go to your Mounjaro and seek immediate help. Okay, so what do? How can you prevent these complications? That's the key. The key to prevent these complications is make sure you always seek help even before you start these medications, because it's important to be assessed properly. If you had some bowel surgery in the past, or if you had bariatric surgery, or if you've got conditions like Crohn's disease, ulcerative colitis, or you've got a slow gut anyway, it's very, very important that you seek help and don't start these medications unless you sought some help. So assessment before you start this medication is important. Always ensure that you're well hydrated. Have small meals, lots of fiber. Avoid fried food and spicy food. And that's the trick. That's the trick to avoid these side effects, especially gastroesophageal reflux, nausea, and vomiting. So the trick to avoid these is make sure you dose escalate very gradually. Don't quickly increase the dose of these medications. Take your time, discuss with your doctor, follow the advice by your dietitian. Very, very important. And last but not the least, I'm just repeating it again and again. If there is prolonged symptoms, if it's the severe abdominal pain, seek immediate help and don't take any of these injections. If there's any further questions, please leave your comments at the bottom, and I'm happy to answer this. Take care.